I think the one question that I did hear asked, though, which I heard kind of, well, we'd have to come back and talk about it, but that is the question of what if the federal dollars do not come to cover the cost of this program? And then who's on the hook for those expenditures, presuming that we would take care of them? Will it then fall to the states to pick up any slack when the federal government does not come through? Last I heard, federal government wasn't exactly flush with money. So, I think when you know that things are pretty tight there, matter of fact, a little bit worse than they even are here, I think it is a logical and reasonable question that if we don't know the answer now, we better find it out in regards to caring and taking care of these people. Then if the federal government, and that is that big if they do not.
Mr. Johnson.
Then what?
I think we, as a state, would have to reassess in what form we could provide coverage to this population. I mean, obviously, there'd be a large hole of roughly $500 million a year in the cost of serving them under this version of the program, the medical assistance program that we have. It's unlikely, I think you're not incorrect, that the state would have that money, and that would mean we'd have to revisit if there's another way to go about serving this population. But I also have to say I've never experienced a situation where the federal government pulled out on a dime. It's always been, there's warning, there's an ability for legislature to get, there's some process that's put in place, some time is put in place for us to have the ability to make it a sound decision prior to the federal government backing out or ending the program.
I would say in the past that might have been the case. I don't think that we're in a time right now that some of those histories of the past, that the federal government will always just be there and come through with the additional dollars. I think that piggy bank has been shaken so much that I don't know that that's going forward into the future that I would be quite as confident about that.